Hey there, I'm really glad you're here. If you're watching this, you probably have a parent or someone close to you who has been diagnosed with Alzheimer's or is experiencing symptoms concerning for it. Maybe you're asking yourself, what happens next? How do I help them? What does this mean for our family? By the end of this conversation, you will not only learn about the science behind Alzheimer's, but also what you can do and how to navigate the journey. Hello and welcome to NeuroMonk. I'm Dr. Appaji Rayi, a board certified neurologist, and I'm on a mission to create videos that provide insights about neurological conditions, those that affect the brain and the nervous system. I believe that knowledge is power, and so understanding the conditions that impact you or your loved ones is the first and most important step in taking charge of your health and well being. So today, let's tune in and discuss about Alzheimer's disease, a condition that is affecting millions of people worldwide. So what is Alzheimer's disease? Alzheimer's disease is the most common cause of dementia, a term used to describe a decline in cognitive function severe enough to interfere with daily life. It's a progressive disorder, meaning that it gets worse over time and it primarily affects memory, thinking, and behavior. It starts small with small things like forgetting a word, misplacing object, or repeating questions. But over time, it takes away bigger things like recognizing faces, remembering how to dress, how to eat, and eventually even how to communicate. So, what causes Alzheimer's? The scientists are still figuring it out. But here's what we know at a cellular and molecular level. There are two main culprits, plaques and tangles. These are toxic proteins that build up in the brain. Beta amyloid plaques form clumps between cells, blocking their communication and responsible for the memory loss or the clinical effects it causes. And inside the cells, tau protein twists and tangles. These proteins disrupt communication between brain cells and eventually lead to cell death. Over time, the brain shrinks or atrophies, and the person loses the ability to perform even the simplest tasks. And while the exact cause of Alzheimer's is still unknown, several risk factors have been identified. Age. The risk increases significantly after the person crosses age 65. Genetics. Certain genes like ApoE4 are linked to a higher risk. Familial Alzheimer's caused by mutations in genes like APP or amyloid beta precursor protein, presenilin 1 and 2, is rare but can lead to early onset Alzheimer's. Poor lifestyle choices, like lack of exercise, excessive alcohol intake, poor diet, and smoking, they are bad in general, but they also increase risk of cognitive problems like Alzheimer's. Health conditions like high blood pressure, diabetes, and obesity, these all cause cardiac diseases and strokes. They also increase the likelihood of developing Alzheimer's. And trauma, a history of severe head injuries also plays a role. So, understanding all these risk factors can help in taking proactive steps to reduce the risk of developing Alzheimer's disease. So, now what to do when the symptoms are encountered? If your close one is experiencing changes in memory or behavior and you suspect dementia, you may feel unsure where to start or even get lost. But here's what you need to do. Find a good doctor, a neurologist who specializes in Alzheimer's or memory disorders, and they can help you guide treatment options and also give you some direction on the progression. Start planning early. This is very important. This means making medical decisions, finances, arranging for power of attorney when the person's mental abilities or cognitive abilities are still intact. The future will be very grateful to you. Create a daily routine. A structured schedule helps reduce confusion and makes life feel more predictable for your loved one. Lean on support. Join a local or online Alzheimer's support group. This isn't something you should go through alone. Take care of yourself. Make sure you're getting enough rest, eating well, and asking for help when needed. There is research that caregivers often face emotional and physical challenges as they support their family members through this journey. How the disease progresses. Now, Alzheimer's doesn't just appear overnight, it moves through different stages, and knowing what to expect can help you prepare in advance. So, Early stage or the mild one. So your close one might forget recent conversations, have trouble finding words, or getting lost in familiar places. But during this stage, they're still independent for the most part. Middle stage or the moderate stage. This is usually the longest phase. They usually start struggling with daily tasks or activities of daily living, cooking, dressing, managing money. And you also might notice that they have some mood swings, anxiety, and become angry as they become more confused. Late stages or severe stages. In this stage, they may not recognize family members, lose their ability to communicate, and will need full time care. But even then, they still feel love, comfort, and connection. That's one of the most important thing I want you to take away. Even when they can't remember your name, even when they can't speak, they still feel your presence. The way you talk to them, hold their hand, play their favorite music, it matters a lot. Even in the later stages, those small moments of love and familiarity makes a lot of difference. So now, treatment and what's ahead. Right now, there's no cure for Alzheimer's, and I know that's a tough thing to hear, but there are treatments that can help manage symptoms. Medications like donepezil and memantine can help slow memory loss. One of the most exciting advancements in the recent years is the development of monoclonal antibodies, and these drugs target amyloid plaques in the brain, aiming to slow the disease progression. While they're not a cure, they represent a significant step forward in Alzheimer's treatment. Lifestyle changes are the ones which can be targeted the most and be very proactive in this aspect, like exercise, social interactions. A Mediterranean diet can help keep the brain active and also play a crucial role in improving the quality of life. And here's the good news: science is moving fast. Scientists are making strides in early detection using tools like blood tests and brain imaging, identifying the disease before the symptoms appear, trying to identify like biomarkers. There's a growing focus on prevention with studies showing that lifestyle modifications like healthy diet, regular exercise, and mental stimulation can reduce the risk of cognitive decline and, in fact, improve memory. But perhaps the most important breakthrough is the growing awareness that people with Alzheimer's are more than their diagnosis. They're individuals with unique stories, talents, and contributions to make. And with the right support, they can continue to live meaningful lives. So now, if you're going through this, I want to remind you you're not alone. You're doing the best you can, and that's great. And if you ever feel like you need to talk, reach out in the comments below or find a support group with whom you can discuss. Alzheimer's is tough, but love, patience, and support can make this journey easier. Take care of yourself and remember, your love still reaches them even when their memory fades. You got this. This is Dr. Appaji Rayi signing off. Cheers.